They patrol the wooded areas, soldiers from the African Union. Their mission? To protect internally displaced women caught in a war between the government, militias, including the so-called Janjaweed, and various rebel factions in Sudan's Darfur region.
When women go to collect firewood, people on camels appear and chase the women down.
We have to accept it. I mean, we have to accept it that there is a war. And in such a war, there is mobilization of people. They live vulnerable life.
Vulnerable to sexual attacks and in need of services. But how exactly are health services provided to victims of gender-based violence and to all women in need during crisis and armed conflict? Medical care and reproductive health items are being provided by UNFPA, the United Nations Population Fund, to 700,000 internally displaced persons, as well as the more than 1.8 million conflict-affected people in Darfur. Over 20,000 sexual assault victims have received rape treatment kits, and private rooms, like this one, are provided for women who have been attacked. But treatment of gender-based violence is not the only need of women living in such a crisis situation.
You don't stop giving birth because you're on the move, because you're fleeing from violence. If there isn't adequate health care for a mother that has complications in pregnancy, that could be the difference between life and death.
Nearly 30,000 delivery kits yearly are given to local hospitals, and nearly 20,000 women per month receive contraceptives. While these services are all valuable, the threat to the women of Darfur will not end until all the warring factions lay down their arms. A peace deal between the government of Sudan and one faction of the Sudan Liberation Army rebels was signed in May of 2006, but the other rebel factions refused to sign.
The rebels, only one part of maybe 3 or 4 parts signed the agreement. We have to fight hard to make these other groups be convinced to sign the agreement.
This report was prepared by United Nations Television for CNN World Report.